How are you guys doing? Kamusta po kayo? In this video, we are going to talk about childhood obesity. So firstly, we will discuss body mass index and what doctors use to categorize children as underweight, normal weight, overweight, and obese, and why parents should worry about childhood obesity. We are also going to discuss complications that might arise from childhood obesity, and as well as what parents can do at home to help overweight and obese children. So keep watching, all right? Is your child obese? Should you be worried if your child is overweight and obese? According to the World Health Organization or WHO, childhood obesity has become one of the most serious public health concerns in the 21st century. The problem has gone global. From a data in 2016, overweight children less than 5 years of age has reached up to 41 million, and that's a lot. And the sad thing is, overweight and obese children are likely to stay obese into adulthood, and along with it comes complications such as diabetes and cardiovascular disease, and these arise at a young age. The thing to note is childhood obesity is largely preventable, so we can do something about it. So, how do we categorize children as overweight or obese? We use the BMI or the body mass index. And how do we get it? So, we get the child's weight in kilograms divided by the square of the height in meters. That's the BMI. There are two charts. One is for boys and another one for girls. For example, what we have here is the BMI chart for boys aged 2 to 20 years. On the x-axis is the BMI and the y-axis is the child's age. Underweight children are those who are less than the 5th percentile, and in the chart, they are in the orange part of the chart. Normal or healthy weight children are in the green part of the chart, and they are from the 5th up to less than 85th percentile. And then the yellow part of the chart are overweight children, and they are greater than or equal to the 85th percentile up to less than the 95th percentile. And lastly, obese children are in the pink part of the chart because their BMI against age is greater than or equal to the 95th percentile. Now we are going to discuss some of the reasons why a child might be overweight or obese. One reason is that he or she might be predisposed to being overweight or obese because of a certain genetic syndrome, examples of which are Prader-Willi syndrome, Turner syndrome, and Down syndrome. Another reason might be because of hormonal disorders that cause weight gain. For example, growth hormone deficiency or growth hormone resistance and polycystic ovaries. And also, medications may cause weight gain. So, if a child is taking certain medications that are predisposed to gain weight, such as sulfonylureas, cortisol, and other glucocorticoids, tricyclic antidepressants, oral contraceptive pills, and insulin in excess. So, the reason why a person is overweight or obese is because of energy imbalance. Excessive fat accumulates when the total energy intake exceeds the total energy expenditure. So, energy imbalance results from an excessive energy intake in the form of calories or from a reduced energy expenditure in the form of a sedentary lifestyle like excessive TV viewing, excessive computer use, and of course, insufficient physical activity. So, the global increase in childhood obesity can be attributed to two factors. One is the shift in our diet to more energy dense foods that are high in fat and high in sugar, but low in vitamins, minerals, and micronutrients. Another reason for this global increase is because of the trend towards decreased physical activity brought about by changing modes of transportation, where we now take the bus or train, and there is less walking or riding a bike. Also, because of increased urbanization and a trend towards a more sedentary recreation time where we enjoy watching TV or playing video games. Should we worry about childhood overweight and obesity? Yes, we do, because along with it comes complications. Acute or short-term complications that might arise from being overweight or obese are number one, orthopedic disorders like a genovalgum or a slipped capital femoral epiphysis that might require surgery. Another is a non-alcoholic liver disease or a fatty liver. Another acute complication might be depression or cardiovascular and endocrine disorders such as hyperinsulinemia or increased insulin resistance. And these are increased risk for type 2 diabetes. Another thing would be hypertension or hypercholesterolemia. Now, we should also worry about long-term complications. A child who is overweight or obese is at increased risk for being overweight or obese into adulthood, and long-term complications that might arise from obesity. Number one is diabetes. Second, cardiovascular disease like myocardial infarction or heart attack, gout, colorectal cancer, and psychosocial dysfunction like anxiety or depression. So now, I hope you're convinced on why you should worry about childhood obesity. The first thing you should do is talk to your child's pediatrician. When you're bringing your child to the doctor will do a history and examine your kid, and then will request some laboratory investigations. So the general approach to this is to control weight gain and reduce BMI in a safe and effective manner. Can we fight childhood obesity? Yes, 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 we can. You can do something about it. It just takes the right mindset and getting the whole family involved by eating healthy and being more physically active. What you can do at home is to increase the consumption of fruits, vegetables, legumes, nuts, and whole grains. Try to decrease your total fat intake and try to avoid saturated fats and take more of the good fat and limit the intake of sugar. And of course, increased physical activity. So encourage your child to have moderate or vigorous physical activity for at least 60 minutes per day. Alright, that's the end of our video. I hope I helped you guys and you enjoyed watching the video. Thank you. Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?